Good morning. My name is Pranshu Agrawal. I am medicine third year student. So today we will start with pediatric nephrology. One of the most common congenital anomalies of the renal system in pediatric patients is unilateral renal dysplasia, or which is also known as multiple cyst kidney disorder, MCKD. This is more common on the left side. There are multiple cysts which may replace the normal tissue. That is why it is known as multiple cyst kidney disorder. The renal function is absent on the affected side. Yes, the renal function may be absent on the affected side. The contralateral kidney shows hypertrophy. But overall, the renal function is normal. Overall, the renal function is normal. Because it is compensated by the normal kidney. The cyst present in this shows spontaneous involution. The cyst regresses by 5 to 7 years of age. Yes, the cyst regresses by 5 to 7 years of age, but still, after the regression, the function won't be normal. The features of this anomaly are abdominal mass in the loin region, but otherwise it is mostly asymptomatic. This is one of the most common cause of palpable abdominal mass. MCKD is one of the most common causes of palpable abdominal mass in a newborn. MCKD is most common cause of cystic disorder of kidney. MCKD is one of the most common cause of cystic disorder in kidney. So this was for multiple cyst kidney disorder. Thank you. Like, share and subscribe.